Blue Sky, we work At Blue Sky, we work closely with CSR teams and implementing partners across India. And one thing that has stood out consistently is that when the monitoring of a program is designed well, it becomes a source of clarity, confidence, and real program momentum. We've also seen that across multiple sectors that we work in education, livelihoods, financial inclusion, health, where simple but very intentional monitoring and evaluation practices have helped organizations scale their programs faster and also learn continuously. I'd like to give you a quick overview of the work that we do here at Blue Sky. So, the next slide, please. So at Blue Sky, we are into uh, designing custom frameworks for monitoring and evaluation aligned with ESG and SDG goals. We bring in deep domain expertise and on ground execution knowledge of programs across various sectors that I just mentioned. And we deploy transparent and scalable methodologies for the tracking of programs and the assessment of them. We've been around since 2018. And moving one slide forward, please, the next slide. So we work across four solution
Yeah,
approaches.
check the PPT.
Hey, hello, Shivani. Very warm welcome to you. I'm just introducing the topic, and your PPT has been opened at our end. So we will share our PPT, share your PPT.
Sure.
Yeah.
Yeah,
Thank you. Okay. So we work across the domain of CSR and ESG using these four solution approaches, one being awareness, which is capacity building initiatives for implementing partners for the corporates on the topics of CSR and monitoring. We design CSR policies, theory of change, LFAs, logic model, that is, and we also work with nonprofits and CSRs to conduct due diligence of partners. Uh, we work with, again, the nonprofits for field level monitoring and coordination, developing MIS systems. We have a platform where we host the MIS systems of organizations, providing it as a SaaS product, and also assessments for the regular monitoring of the programs that are implemented. So, on the next slide, you will see that we have an accreditation from the NABCB, which is a body of Quality Council of India. So we are an accredited inspection body, one of India's only first accreditation bodies in the domain of CSR inspections. And we deploy certain tools and methodologies which have been accredited by NABCB, which falls under the Quality Council of India. So, having introduced Blue Sky, I'll come back to our topic for the day, which is monitoring and evaluation. So, from the point of view of today's topic, I'd like to share that we believe that monitoring and evaluation at its best, it's not about reporting, but it's primarily about learning. And it's really a bridge between the intent of an organization and the transformation that it wants to go through. And when teams can see that progress clearly, it really makes decision making based on real time insights, close the feedback loops, and impact just doesn't grow, it compounds. So, which brings me to our speaker for today. We've invited Shivani Mehrotra. Shivani is someone who has not only run large scale CSR programs, but she has truly embedded the principles and the structures of monitoring and evaluation into the DNA of implementation at her organization, Apollo Tyres. She is a divisional head of CSR at Apollo Tyres, and she has over 16 years of experience across domains of health, livelihood, education, and environment. She has led transformative initiatives, including empowering more than 20,000 rural women through sustainable livelihood programs. And what stands out about Shivani, I have worked closely with Shivani, and what stands out about her is her strategic yet deeply empathetic approach. So she designs programs with clarity, ensures that there are strong MIS systems, ensures that there's data driven learning, and she's also consistently, she and her team is invested in SROI studies, surveys, and impact assessments that are strengthening their accountability on scale. I'm privileged, we are all privileged to have you with us today, Shivani. And Shivani will be sharing with us her rich and practical insights from Apollo's CSR journey and how Emini has worked for them, what has worked, what has evolved, and what it takes to build a system that truly sustains impact at scale. Over to you, Shivani. A warm welcome to you again.
Thank you so much, Prajakta, for the such a big, great introduction, and actually privileged to be here on this particular platform. We know Blue Sky over 5 years, and it has been a great journey working with Blue Sky for our impact assessment and the various kind of other studies. So delighted to be a part of this insightful session.
Thank you, Shivani.
So, Prajakta, how you want me to proceed further? Should I just run through the presentation, or you want to make it interactive? What would be the
Sure. Love to
Mm,
make it interactive. In fact,
yeah,
thanks for handing this back to me just for a minute. I
yeah.
wanted to also engage our participants as we get started here. So, everybody has access to the chat on this webinar. And one of the question that I just wanted to launch our talk for today is a quick one-word answer on for all our participants today. One question: what does monitoring and evaluation mean to you? We're looking for one word answers on what does monitoring and evaluation mean to you. The first word that comes to your mind. Let's see what kind of a word association we get. And then we tee it up for Shivani to take us deeper into it. Seeing the chat coming up, showing impact, change, data driven decision making, deliverance, accountability. Interesting. Measuring the process. Okay, somebody's talking about process. Learn and improve. Okay, some more if we can. Assessments. Okay, all right. So Shivani, I think we've teed it up for you. We are talking about learning, we're talking about assessments, accountability, data driven decision making, change, and theory of change. And now I
Very
hand it over
interesting.
to you.
Yeah. So whatever the feedback we have got it's all right actually, and these are the major things which actually makes the overall monitoring into converting into a learning space. So now Prajakta has already set the tone for today's discussion, and we are here to learn with each other more about monitoring and evaluation, how it can actually contribute for the betterment of the CSR programs and creating better impact. So I'm Shivani Mehrotra, and I'm taking care of Apollo Tyres CSR. And just to directly jumping on the topic, at Apollo Tyres, as I mentioned in my first slide, CSR is not the compliance, but it's part of our ethos. We started our journey way back in 2000, and the compliance came in 2013. So you can very well imagine the kind of commitment organization is having towards giving back to the society and creating a positive impact in the lives of its stakeholder. So CSR is one of our key value which the organization has identified. We can go to the next slide. And wherein we talk about that it's a process of creating a better tomorrow, and
Chandana,
we
next slide, please.
We actually believe that by investing in our people, into our community, we can create a better society, and we are committed towards the positive development of our stakeholders. When I talk about stakeholders for Apollo is its customer, its community around the manufacturing location and environment we operate in. We at Apollo, we follow a very scientific approach. We do not cherry pick the initiatives, or just do not do it in a manner that we are working in all the space. Our process and our values are that we need to have a business linkage, and we need to create the positive impact in the life of each of our stakeholder. Our vision is for that we are committed to building a responsible and sustainable business that benefits the society, and through our CSR initiative, we are contributing to that vision. We can go to the next slide. As I mentioned that for Apollo, our CSR journey started in the year of 2000, wherein we actually started our program with the healthcare program as a healthy highway project. And until 2008, we were doing this program in with the partnership with other various kind of NGOs and partners. In 2008, Apollo itself has established its own foundation, Apollo Tyres Foundation, and we came into picture wherein we actually constructed our meaningful CSR. We defined our CSR themes, and basis on that, Apollo has started working not only in the area of in the area of healthcare for trucking community. We actually extended our services into other domain areas as well. So in Apollo, we work in the core four thematic area, which is the which is the main driving force behind our CSR initiatives. So the healthcare for trucking community, as I mentioned, is one of our pioneer initiative, which we started for the truck driver who are the major customer segment for our company. And we started this journey in 2000. The second major initiative is environment conservation, under which we have three major key sub-thematic areas, which is solid waste management and sanitation, biodiversity conservation, and watershed management. Solid waste management and sanitation, where we are actually creating toilet with the bathing facilities around the manufacturing location. Specifically, we are bridging the gap between the government services provided as well as wherever people have not access to the total sanitation, and also creating a waste management system within the community. Biodiversity conservation is one of our global theme, where we are actually working on the nature-based solution, and we are also working on the major initiative which is related to mangrove conservation and afforestation. And the last initiative is, which is under environment conservation, is watershed management, where we are actually creating availability for the purified drinking waters. We have installed RO drinking water plants around our manufacturing location, as well as rejuvenating the water bodies around the manufacturing locations, so that people can have a better access to water. The third major initiative under this particular theme is livelihood for rural women, wherein we are actually creating opportunities, livelihood opportunities for the rural women, helping them to get more source of earnings, being in their own areas. And the last initiative is the local initiatives, where we are actually supporting the basic community needs, which are completely specific to their local needs, which are specific to regions. So these are the key thematic area where we are working. And for Apollo, we always try to have the major linkages with the national agenda as well as with the sustainable development agenda. So all our initiatives are mapped through the sustainable development goals as well as the national priority agenda. So can we go to the next slide? Now coming back to the topic, I have just created a tone about the program, what Apollo is doing. Now, if I talk about why monitoring, evaluation, and learning is important for Apollo, and why we have actually focused a lot in this. So for Apollo, it is like it's a continuous process, and we actually initiate. If I talk about the monitoring and evaluation, it starts from the very beginning when we identify any project or any area where we need to work upon. So it starts from the identification of the agency whom we will be hiring for the baseline assessment, and on the parallelly identification of the NGO or our implementing partner who will be actually working with us on identified issues. So on one side we focus on the due diligence aspect of the NGOs whom we are identifying, and the other side of it we actually focus on starting collecting basic information about the community issues, and then reaching out to the conclusion that which could be the better intervention for the particular targeted community. So for Apollo, it's a process driven structure, and how it actually the kind of benefits it has given to us is it actually helped us in measuring the impact and effectiveness of our programs, whatever we are doing it over the years and what we are investing into it. It also helps in terms of as an organization as well as from the implementing agency point of view, that
Mm.
ensures the accountability and transparency, because we are working in a larger space where these days data is actually evaluated across platforms, and informations are available in a public domain. So when you
Mm.
are having a strengthened M&E system, uh, it actually creates a very strong backup that your data is just not a numbers. It is actually supported by a credible organization who has conducted the impact studies or a midline studies. So that's how
Mm.
it helps us in creating the transparency. And
Mm.
obviously, basis on the data and basis on the trend and findings which we are identifying in our initiatives and the studies, it helps us in developing the strategy for the coming years, and it helps us also improvising our program at a better level. And definitely the MEL exercise has actually given us multiple places the opportunity for the course correction, where we thought that a specific strategy or a specific things will go right, but
Mm.
when we conducted the midline assessment or when we conducted these studies, we identified that a particular strategy is not working or a particular initiative needs to be remodified. So those are the things which MEL exercise actually gives you the benefits. And last is the major thing which we have done it, and we have got the advantage from the MEL exercises. It actually gives you the scope of scaling up your program, because when you are conducting these studies and research, you also get to know about the other partners and other stakeholders who are working in this particular space. It actually gives you
Right.
the
Mm.
opportunities how you can actually scale it up your program with the more collaboration and with
Right.
the
Collaborative.
convergence.
Mm.
So that's how it has helped Apollo, and that's why for us, it's a Bible. Without any MEL, we cannot proceed further. That's the thing.
And I like the
So
fact that you're calling it MEL. Like you've absolutely underlined the learning part of it. So that
yeah,
is great.
that's very important, because otherwise it does not complete the loop. That's the major thing.
Fantastic.
So yeah,
Mm.
so we can go to the next slide. So we actually created the MEL process within the Apollo. It's not there is no particular, it's, you may not find this kind of a structure in any research document, or it is
Mhm.
not a scientific process, which I can say, which is like a log frame analysis or a theory of change. It's our
Mhm.
internal process which Apollo has actually developed, which we call it our MEL framework. And what we do it, as I mentioned in our my beginning notes, that we initiate our program with the need identification or a baseline survey, and
Mhm.
parallelly the due diligence of our partners for the onboarding of the partners. So
Right.
the program, once the program is identified, it's confirmed, the due diligence is in place, the agreement is signed,
Mhm.
we actually get into the program implementation side of it. And when the program implementation starts, the program monitoring becomes very important.
Right.
And the method of implementation for Apollo is that Apollo Tyres Foundation is a CSR arm of Apollo.
Mhm.
Whatever funds for the CSR we receive, it's routed via Apollo Tyres Foundation,
Foundation. Mm.
and we implement the services of the grassroots level NGOs for as an implementing partner. We do not implement the programs on our own.
Right.
Maximum places we are having the partners in place who actually implement the program
Hmm.
on behalf of Apollo.
Right.
So, and in each of the vertical, so we, as I mentioned, healthcare program for the trucking community, that's a exclusive program which is having a separate team, who is in Delhi and who manages centrally from Delhi location for the other healthcare centers. And then
Hmm.
we have CSR coordinators and CSR specialists at each manufacturing location
Center.
who
Right.
are responsible for their CSR program implementation.
Okay.
So they are the face of the CSR program across all locations. So whenever we are when we sign a MOU with the implementing agency, the responsibility of the CSR implementing CSR coordinators becomes very important at Apollo's end. So these are the face of Apollo Tyres Foundation. And so the Apollo Tyres Foundation employees ensures that they are conducting a regular field visit. And when I'm talking about the field visits, these are the weekly field visits, and they
Okay.
go on a weekly basis to the field, and they monitor the program ground level implementation at the field. Then comes to the monthly meeting. So when we sign the MOU, the detailed action plan with the deliverables is actually outlaid in the MOU, in the
Hmm.
project agreement, and
Hmm.
that works as a blueprint for us to monitor the program at the end of the year. That
Hmm.
gives us the understanding for the financial implementation as well as
Hmm.
about the programmatic implementation. So the indicators are defined. The program is based on the log frame analysis. We actually, from the implementation side of it, we monitor the deliverables basis on the log frame analysis and the annual action plan we put in place.
Right.
And on the financial side also, we, because at the end of the day, CSR Act says that you have to consume your funds in a
Yeah.
particular year. So to
Correct.
ensure the effective utilization of your funds which is being laid down against the activities,
Hmm.
also we monitor. So monthly meetings are happened with the, that's a given that you have to undertake the monthly meeting with your agencies to create a plan for the next month and to generate the fund request from us for the implementation. So
Hmm.
that's how monthly meetings becomes very important, and that is being done by the local team. 6 month before that, we also conduct the quarterly review, and therein the people from the head office team is also involved, where we also
Okay.
interact with the NGO partners and we actually monitor their services against the program which we have conducted. And within 6 months or a quarterly basis, the team from the head office also visits the manufacturing location and the program sites, and we
Okay.
go and we try to see the real time work which is happening at the field level. And at the
Hmm.
end of the year, the financial year cycle, the report comes from the implementing agency side of it, which actually gives us the detail about the work we have done it in the year's time.
Hmm.
So that till here, the yearly report, it is mostly on the monitoring side of it, where we are actually seeing the milestone on a yearly basis, how it is being
Right. And
delivered, and
utilization of
yeah,
funds, etc.
utilization of the
Right.
funds, or if the fund
Right.
activity is not done in a specific month, how we are
Hmm.
making a plan for the next month execution, and that's how we get into those nitty gritty.
Right.
And the evaluation side starts after that. So when I talk about the evaluation, we have actually worked out the mechanism that at the before the beginning of the project, we will be conducting either the need assessment or a or the your baseline
Baseline
study.
studies. Yeah.
Yeah, and after completion of the 3 years of a project, when the program gets mature for the 3 years, we conduct the midline assessment.
Hmm.
Midline assessment is a milestone which actually gives us the understanding about the mid-course correction and the short-term outcomes we have created from our program. That
Okay.
actually help us in measuring the short-term outcomes which the program has created, and how the program is proceeding. Is it going in a right direction, or we need to change the strategy, or we might have to engage with some other partners? Whatever is the situation, that works as a uh, basically a base point for us to reevaluate our work if at all there is something which is not going right. And it
Hmm.
also gives us the understanding that the program is going in right direction or not. Then
Right.
after fifth year of completion of the program, we undertake the impact studies. So the impact studies are nothing but they are the basically how the program has created a long-term if impact in the
Mhm.
community because of our interventions. And now with the CSR Act, it anyway is a mandatory requirement
Mandatory.
depending upon the funds a project is incurring into. So basis on so for us, again, as I mentioned, I would say that we were visionary enough that
Yeah,
we
I was
included
just going to say that. Before
we
the act followed you,
yeah,
you were following the
yeah.
act.
So actually, so we are conducting impact studies, I would say over 10 years and so on, that
Absolutely. Mm.
and now the act has actually put it as a compliance requirement 2 years back. So that's
Yes.
how you can imagine that how robust is the system where we are actually doing and impact the so the 5 years things we complete the impact study. And at the 10 year of the completion of any project cycle, we get into a SROI, which is social
Mhm.
return on investments
Right.
studies. And just to give the understanding to the audience, none of these studies are done in house. We always undertake the services of the third party to avoid any kind of biasness and to avoid any kind of conflict. So that's where it actually gives you the strong support in terms of accountability and transparency as well.
Absolutely.
And SROE study actually helps you in terms of evaluating the investment we have done it and the kind of social benefits the society has gained. So those are the things we actually complete. This is only about monitoring and evaluation. Now comes to the favorite part, which is learning.
Learning.
So yeah, so without learning, you cannot grow. That's what I have understood so far in my career. So the learning is basically you need to adapt the findings and you need to adapt those suggestions which has been given in the
Mm.
reports.
Mm.
And that's how we actually put the program at a next level, because the learnings and the
Right.
findings takes the program to the next level. And
Mm.
it helps you how you can actually make the program as a
Mm.
big success, or it is like a trendsetter, I would say.
Yeah.
So that's how we complete the MEL cycle. And
So very quickly, Shivani, two things.
yeah,
So I think I just love the fact that how you've broken down the M and the E, and you talked about it both, and
yeah,
you spoke very early on that the scalability comes only through learning, and I think it's music to most of our years. We're actually putting things like 3 years and 5 years and 10 to 15 years, because in today's day and age, with a lot of organizations taking the compliance route, projects seem to be shorter in nature, and I think we all know that real social change does not happen in a year or two. So just your commitment to stay at it in a program for multiple years and doing this, I think it's just laudable. So
thank
great.
you.
And of course, now you're going to tell us how you have learned and you have scaled your programs. So over to that.
Yeah. So we can go to the next slide. So now here I would like to showcase the case study of our one of the most favorite initiative, or I would say a pioneering initiative of Apollo Tires, which is healthcare for trucking community. Recently, we have completed 25 years of the program of our healthcare program for trucking community. So it is a very big initiative for the organization, and we take really a big pride whenever we talk about this program. It is very close to our heart. So the healthcare program of trucking community, as I mentioned, started in the year 2000 as a healthy highway project, and it started focusing on it was basically with the focus on HIV/AIDS awareness and prevention. And can
Mm.
we go to the next slide? And over the years, we have actually evolved as a organization, and this program has evolved. And we started with the first center in Delhi, and
Mm.
now in past 25 years, Apollo has opened 34 healthcare center in transshipment hubs, presence in 21 states, and we have reached out to over 11 million beneficiaries through our healthcare services, which is a very big
Mm.
number. And when we talk about the healthcare program, the program is specifically catering to the need of the trucking community, and it
Mm.
is very thoughtfully it was curated that the program will be implemented in the transshipment hub location, because the maximum time the truck driver spends is in the transshipment
In
hub
those
location.
hubs.
There, that is the
Mm.
time only you can actually get them
Engagement
engage
with
with
them.
them. Yeah.
Right. Mm.
And the health seeking behavior amongst this community is very low, because they are
Mm.
always on the move. They
Mm.
do not get the access to the healthcare services because of the lifestyle and the work pressure they live into.
Right.
So
Mm.
Apollo realizes the need, because one is that they are our bigger customer. The major revenue in India comes from the truck tire sales. So they
Mm.
are a very important stakeholder for us. And for Apollo, we do the CSR with business linkages. And then we realized that this community is the most vulnerable community related to the healthcare issues. So that's how we
Mm.
started the program in 2000.
Mm.
And we can go to the next slide. Uh, so these are the key services which this program offers, which is HIV/AIDS awareness and prevention, vision care, awareness on tuberculosis, diagnosis of NCDs, general healthcare treatment, and recently we have also introduced oral hygiene is
Mm.
one of the program as a core service among this particular initiative. In the 34 healthcare center, it is staffed with doctor, paramedical staff, and counselor. And then we also have the outreach worker and the.
Shivani, we are not able to hear you all of a sudden.
Oh, what happened?
Yeah, yeah, good now. Good, good,
Good now? Okay.
good. I
Yeah.
think, yeah,
So
good now.
something, some tech issue. So yeah, what I was saying is the program is catering to the need of the trucking community, and the health center is equipped with qualified doctor, paramedic staff, counselor, and we have a very unique approach in terms of the behavior change communication, where we actually engages with the outreach worker and the peer volunteers. Peer volunteers are no one but they are the local people in the community with
Mm.
whom the truck drivers engages on a regular basis. They are the tea stall vendor or the dhaba or eatery owners or the mechanic in the local area. And actually Apollo has they have shown they are the volunteers. They are the key messenger of our program, and we
Right.
engages with them for the awareness activities, passing on the messages to the truck drivers and creating awareness. And we train them, we do their capacity building for the healthcare awareness initiatives, and that's how
Mm-hmm.
they pass on the messages to the trucking community. Can we go to
Mm.
the next slide? So, Apollo, when we started our journey, so the program actually started with the first healthcare center, which was in the with the HIV/AIDS awareness and prevention. And in
Mm-hmm.
2015, we can actually go to the next slide. I will talk about the this slide afterwards.
Yeah,
I want to first focus on how we have actually
and
utilized
the monitoring into
yeah,
learning.
monitoring into learning.
Right.
So uh, 2000 we actually started the program with the HIV/AIDS, and through our services, through our OPDs reporting, we were actually noticing the trend, which was basically that there is a issue which is very common amongst the trucking community, which is the vision issue. The long
Mm-hmm.
distance vision is coming as a major problem. And then in 2013 we actually conducted the first SROI study, because the program completed over 10 years, and we conducted this particular study, and that also gave the similar finding that vision care was identified as a major area of concern.
Okay.
And the
Okay.
recommendation came in that we need to actually look into the vision care as another service. So in
Mm-hmm.
2015, we actually initiated a pilot project in Delhi with the SLR Vision Foundation, and we started working on the vision care issue. And then later on, we actually established the program across all our healthcare center, and we created the facility of optometrics in all the healthcare center. And SLR Vision Foundation actually, in the partnership, we created the facility of access to the basically affordable glasses. Because what happens is, you go to the doctor, you get your eye tested, he says that it is, you have a eye issue, but then it comes to the problem wherein you actually lack access to the eye care facilities, the tools. You don't get the glasses at affordable rates, and then you just drop the idea, okay, it's fine, they continue.
Right.
So we
Hmm.
actually ensure that when the truck driver is coming to the facility, we will be ensuring that they are getting tested and they get the even glasses at the center itself, so that they need not to go at any other places, and they can actually safeguard, and that helps in obviously their livelihood as well, so that they will be taking care of the driving and other things. Then in the 2017, when I talk about, was the another turning point when we introduced the third major service of our program, which is the tuberculosis program. Tuberculosis is another program wherein Apollo actually got into it, and we conducted a baseline study, and we realized that majority of the truck drivers were not aware about TB and its symptoms, and
Right.
TB and HIV as a
Correlation.
co-infection correlation, and they have the they are more vulnerable if you are having a HIV
Hmm.
infection, so you are more vulnerable to tuberculosis. And that's where we actually collaborated with Ministry of Health and Family Welfare, the union, and USAID, and Apollo committed for the corporate TB pledge, wherein we actually committed that there is no discrimination against the employees, specifically if it is TB positive. We signed a pledge, and Apollo took that as a major initiative to work in the space of TB elimination and joining the Government of India agenda of end TB by 2025. And we are continuing in that service. And partnership played a very key role for this particular initiative. We opened 17 microscopy center in that particular
Okay.
space. And then
Hmm.
in the year 2022-23, we again conducted the second SROI study, and that's how we actually realized that in the previous SROI study, which was conducted in the year FY20, so the 1.39 finding was basically in the year 2014, which was the base year when we conducted the first SROI. And it
Hmm.
got actually increased from 1.39 to 1.83. So you can see that there is almost an increase of 4 to 6 times in the return of investment which we were doing it, and that gives
Right.
us the confidence that yeah, we need to continue this program, and we need to be investing more in this initiative. Can we
So
go to
true.
the next slide? So when I am talking about monitoring, evaluation, and learning, it is again, as I mentioned, that the program has evolved over the years, and we have of any services or any new initiative, we have actually done it first as a pilot testing across our location, and then we have scaled it up, because pilot testing gives you the understanding about the success and the failure of the program. And so we have actually incorporated the learning into the program implementation and expansion. These are some key outcomes so far. What we have done it. These are the major KPIs, I would say, which we have defined to measure the success of the program in terms of the outreach, which is the over 1 million, 11 million people we have outreach to our program.
Hmm.
Presence is in 34 center in 21 states. When I was talking about the peer educators, across 34 centers, we are having over 1190 peer educators. These are the people who are actually volunteering, contributing to the healthcare program, and they play a major role in the referral services. Because
Okay.
whenever a truck driver
Hmm.
is going and sitting at the, suppose at a tea stall, and he just discuss about that, I am not feeling well on this and that, in that chit chat only, the tea stall owner says is ki, oh, there is a health center by Apollo
Okay.
in this, and you can go and you can access the services, which is at a very minimal cost. So that's how one is the referral for the services what is available in the transshipment hub, and also the awareness side of it, the safe behavior and the health seeking behavior in terms of the tuberculosis or HIV, those kind of things they are trained into, and they actually do it. And in this particular initiative, we have actually included the LGBTQI community also 2 years back, the
Hmm.
transgender population. Over
Right.
102 transgenders in this particular area is active peer volunteers, and they are the major source of referral to the trucking community, and they are playing an active role in the success of this particular program. So we can go to the and the partnership, as I was mentioning, is a key to this particular success of this program. We are collaborating with government for the program. There is a technical partnership with all the state aids control society, central TB division, and
Mm.
all the supports, the technical IEC material and everything, we get it from the SACs. The 17 microscopic centers for the TB has been established with the support of the central TB division. And in one of the center in Vijayawada, the program has actually opened the first ART center, antiretroviral therapy center for the HIV treatment. That is also in
Okay.
partnership. And
Mm.
out of 34 centers, we are having 22 ICTC within our facilities. And all these things have been done in the partnership with purely with the government linkage.
Okay.
Yeah, can we go to the next slide? And then we also have the corporate partners. So the corporate partners, actually, this I have already discussed it. We can actually go to the another
Sure.
slide. Yeah, here if I am talking about the key stakeholders and partners, as I mentioned that we have various kind of partnership. We have a government partnership. We are working with the INGOs, and then we work in a very unique model with the corporate partnership, where the corporates are also putting the funds for the same program. And
Programs. Yeah.
it's a joint program. Can we go to the can we go back to the slide? And here Apollo, so we have the key partners, which is Ambuja Cement, which is now Adani, ACC, Ashok Leyland, and Essilor. All these are our key vision key partners with whom we have worked so far, and they are
Mhm.
actually they have contributed to the success of this program. And you can see there is a association like Ambuja is with us for over 19 years. So that's how we actually promote to the 17th SDG goal, which is basically about the partnership goal.
Partnerships.
So
Yeah.
yeah, so and now I would just take 1 or 2 minutes about the accolades and the excel we have received recognition. Apollo, can we go to the next slide? So these are the some major awards and applauds which Apollo has received so far for our contribution for the healthcare program. That's it from my side. It's I am now opening the
Great.
discussion for the audience. Happy to connect with you for the Q&A.
Sure. Thank you, Shivani, and very well deserved accolades. You talked about it. Great. Uh, two things that absolutely stuck with me, the way you talked about the monitoring piece, the evaluation piece, and you picked up a specific example of the health program that's been running for the past 25 years. I think that itself is very commendable for a foundation to run a program for that long. And you told us examples about how the evaluation, the reports that you do at the end of the fifth year, the 10th year, the SROIs have led to feedback on improving the interventions, making them more focused for the stakeholder groups that you started with, which is a trucker community. And I think it's also very I mean it's nice in a way for you to come out and vulnerably say that we started with certain assumptions that HIV was the key problem, and then we started with it. But then as we went along, we found that there are other I'd say like more low hanging fruits that we can quickly address for, and you were able to make those interventional changes. I would like to ask of you that uh, share your experience, if you could, in terms of both challenges and solutions to what you have seen from the M&E perspective, especially given long term projects. Uh, like you said at the beginning, we have a certain hypothesis that we lead in with, and then as we start getting evaluation reports, we start learning from them. So what are some of the things that have stood out as challenges, and how have you worked around them?
Sure. Data consistency, I feel, is the major thing, which is a major challenge in the space of the MNE, because
Hmm.
sometimes, uh, the kind of space we are into. One is about the grassroots level organization with whom we are working, because it's like that you have to, you cannot work with only one implementing agency. Sometimes due to various issues, the implementing partner gets changed, or even from the donor side of it, the leadership also gets changed. So the ideology gets changed, and then the entire narrative gets changed. And one agency whom you have trained with your SOPs and with your overall requirement, when the another agency come on board, it takes time, and that time, that is a major issue. You face it in terms of the data consistency. Some and data does not go in a similar fashion. The second thing also I feel is that M&E is a cost intensive exercise,
Mm-hmm.
because you have to invest your resources, you need to put the money in place. You cannot do the evaluation, because whenever you are going for any studies, it requires a good amount of funds to evaluate the program, and sometimes organization does not put that budget in place where they are having the structured M&E budget where they are investing into and to get into this. So that also is one of the challenge which they, whenever you are actually putting up your program, whenever you are actually making a budget, the annual budget of your program, you actually need to ensure that out of your budget, you need to put some money into the assessments, so
Yes.
that you can actually get it to the more results. And the third important thing I also feel is that under M&E, the major challenge is that even in the long term evaluations also, measuring the intangible outcomes, as
Yeah.
and especially the social change. Because for example, I'll give you the example of the one of the other key program, which is a livelihood for rural women.
Mm.
From the key outcomes in terms of the number of women trained, number of women started income generation, the income increase from A level to B level, all these things are measurable. But when
Yeah.
it comes to the empowerment, when it comes to the
Correct.
decision making or a
Mm.
participation, and like a standpoint, standing in a community, or a upliftment within the family, those
Right.
are the social indicators, and these are very difficult
Intangible.
indicators, intangible indicators.
Right.
You can actually go, you can observe, you can see that change, but purely the you do not have the quantifiable KPIs to measure those things, that
Right.
this is happening. So, and obviously it's a long term process. You
Mm.
invest into a journey of a woman, training them to first come out of their house, standing
Right.
on their feet, making
Correct.
them to earn, and then the empowerment comes at a very later stage.
Later stage.
Even
Mm.
they are earning, but still they are dependent upon their husbands or a key member in the family in terms of the decision making issues. That if
Mm.
something is happening, they will say, no, I will go home and I'll check with my husband, or I
Mm.
will go and I will check with my elder person in the family, can I go and can I take these decisions. Investing into your child's education, those kind of things are still like a things which are very hard to measure. So the social change which is happening because of your intervention is a thing which needs a lot of time, and one needs to be patient enough to actually measure those impacts. So those are the things which I see is the a challenging point. But then if comes to the solution side of it, the first thing is, when I was talking about the data consistency, the major solution what I feel is, if we are applying theory of change in a right manner, then
Mhm.
you cannot actually deviate from the data, because your theory of change is actually giving you the path, how you are evaluate, how you are seeing your program, that the program will be creating a impact or a change in the coming years of time. So if that is clear to
Mm.
you, and you are putting the inputs, outcome, impact theory in place, then it is very easy to implement and monitor and evaluate a program. That's what I feel. And
Mhm.
definitely, the point which I was making about the social change and the intangible benefit, you also need to support your data with the qualitative inputs. The data
Right.
cannot be only
Too
quantitative input.
quantitative,
It
has to be
cannot, yeah,
triangulated
yeah,
across.
it cannot be
Hmm.
quantitative. You need to bring
Hmm.
the social angle into it. It can be supported with the case stories, or it can be supported with the change stories. You need to blend the quantitative and the qualitative side of it, so that you can showcase a better impact of your program, and it creates a better picture of your program. So that is one thing. The third thing which I talk about is, I would say, use of technology. That
Hmm.
is very important now in today's scenario, to
Hmm.
actually create a better, so like geotagging, use GIS mapping, or mobile surveys, dashboard creation. These are the things which actually give you the real time data, and
Data.
this actually creates the transparency. So anybody sitting at any particular place can actually help you to can see your data, can measure your reports. So those are the things, if you are investing into a particular project, and getting your third party assessments, which is actually validating your interventions, what you are doing it. So that's how you can actually create a better MNE in your organization.
Okay, thanks for those very candid sharing. I'd also encourage our participants to uh, share their questions in the chat, if any. So you talked about Shivani, you talked about that the TOC when you start with, that has to be very clear. I think there is a question coming from somewhere. I'll just pause. Uh, yeah, was there a question that somebody wanted to ask? Okay. Okay, I'll encourage participants to either type their questions or turn on their mics and ask the question that they want to pose to Shivani. We have about 5 minutes left
Yeah,
for
am
the
I
webinar.
audible?
Yes, yes, Sonali, you're
Am
audible.
I
Yeah, please
audible?
go
This
ahead.
is Sonali. Yes, yeah, Shivani, it was lovely hearing from you the journey of how Apollo CSR has evolved over a period, with compassion being a driving force about the CSR policies, what I understand. It would be interesting to look at the SROI, how you mapped and what sort of stakeholder mapping was done to arrive at. Is it available on the public forum or?
Yeah, yeah. No, the SROI is not available on a public forum. This is an internal document which we have kept it, but all our impact studies. So whatever we have done it so far, it is available on our website. SROI is because it also has the financial data also include into it. So that is like a confidential document. We generally do not post it on the public domain. But yeah, it was done with the third party. The impact assessment reports of the healthcare programs and the other initiatives which we have done it so far, specifically with the compliance requirement, is all available on our website.
Yeah, sure.
And
Thank you.
the
Lovely to
SROI
go into.
findings we actually do mention in our annual report. So those things you may be able to
Find
find
in
out
the
in
annual
the,
report.
yeah,
Yeah,
yeah.
yeah. Understood. Anyways, I'll have a look at the impact reports also. I
Sure,
was really
sure.
keen on SROI just to understand how it improved, like because you would have mapped. But anyways, I think your impact assessments would also give a little bit of idea around
Yeah,
the
yeah,
Into it.
approaches that were
Yeah.
adopted. So yeah,
yeah.
thank you, Shivani.
Thank you, thank you.
All right. Any other questions? So, Shivani, what's running on my mind is also we have a lot of participants who are representing implementing agencies, nonprofits. So, your thoughts on when nonprofits are pitching such kind of long-term projects? Because generally we see that long-term is a barrier for corporate, but you have spoken at length about very long-term projects. So, how should nonprofits pitching these projects to donors like such as yours should think about the approaches? What do you look for when working with such agencies? If you could throw some light on that.
Sure. So, as a corporate and as a CSR practitioner, we always believe one is definitely a area of expertise. The NGOs who are into, because the subject matter experts brings the more value to the program. That's one particular thing which we definitely get into it, and alignment with our own systems, because what happens is every organization has its own process, and
Hmm.
and you have to do a lot of hand holding. It doesn't happen that a program cannot get success overnight. You need to
Hmm.
put a lot of hand holding to your staff as well as to the implementing agency, and that's how the program get evolve, and it goes to the next level. So align helping the NGOs, there are certain partners and there are certain agencies whom we are working, they are even 15, 20 years old, the implementing partners who are associated with us. And the major success of this program is that they have actually aligned with our requirements. So the SOPs and everything which we have done it, and just to tell you that we have from past 1 year, we have also includes our financial SOPs as a main thing in our program agreement, so
Okay.
that that actually helps us to build the program, and that helps us to ensure the implementation the way we want to get it done in terms of specifically to the financial requirement, as well as because we are putting the log frame analysis also in our agreement itself. So that
Right.
helps in terms of getting the program exactly in the way it is defined. So that's
Hmm.
the second thing which we actually look whenever we are looking for the partner. And the partner also needs to bring it a solution in terms of the long term sustainability. Whenever we
Okay.
are working with a partner, we always see that we as an organization can work for certain years, we
Hmm.
cannot be there for ever. So
Ever. Yeah. True.
the even the implementing agency should have that capability to create community based organization, and they also need to make the stakeholder understand that how they can own the program, because ultimately the implementing agency is the face of the program, they are working
Right.
at the grassroots level.
Hmm.
So they need to they need to speak with the stakeholders, they need to create a ecosystem where a stakeholder started taking ownership of the program. So these are the major things which we see whenever, and then obviously the background and the credibility of the agencies and all the compliance which CSR acts defines to onboard the NGO partner. So we basically, whenever we are hiring any kind of partner, we always look into these 4 5 major criteria to onboard these partners, and that's what I would suggest even the implementing agencies needs to look into, that they need to ensure that the data whatever they are doing it, even if it is you are unable to meet the defined objective or defined targets, you need
Hmm.
to be vocal and you need to be transparent enough with your partner that this is not happening or we need to change the strategy. And you need to be ready with the adoption of new technologies, because now a time is there which is where there is a lot of tech advancement is
Yeah.
happening.
You talked about tech
Yeah,
adoption. Yeah.
yeah.
Significant.
So if the grassroots level agency is not equipped with that, that also creates a hurdle. So they need to be ready with those kind of upcoming changes in the current scenario, and they need to talk about the long term sustainability. That's what I would suggest to them.
Great. Thank you so much, Shivani. On that note, what you have shared today really highlights how strong monitoring evaluation, and you added the right L also to it, isn't just a system, it's a mindset. You think about it right from the very beginning when you're actually planning your program, because you are thinking long term, not short term. And so, in today's conversation, the Apollo journey that you have shared with us, it offers so many lessons for all of us. And thank you for your time, for such rich set of insights. And personally, for me, you always bring so much clarity and purpose to these conversations. Your
Thanks so
ability
much,
to
so much,
translate the
Prajakta.
structures into action, into real, information on the ground is just amazing. Love
Thank
it.
you so much, so much,
Thank you.
Prajakta.
Thanks a
So
lot on
kind
behalf
of you.
all
Thank
of
you.
us here at Blue Sky. Thanks for your time today. And to all our participants today, have a great evening, have a great weekend, and we'll see you again in another edition of our webinar.
Thank
Thank
you
you.
so much, everyone, for connecting. Thank you.
Bye bye. Thanks, Shivani. Bye. For the